Do side effects vary from patient to patient?
Yes, so they actually vary greatly from patient to patient and from drug to drug. There's some bispecifics for some cancers that have low risks of cytokine release, so low that they don't even need to come to the hospital. And some of them have such a high risk of those cytokine release syndromes that people are in the hospital for a few days. The other thing is usually the more tumor someone has, the more disease and cancer they have, the higher those risks of cytokine release. And so it does vary from patient to patient and from medication to medication.
What should care partners understand about caring for someone during therapy?
One of the big things that care partners should look for or to be aware of is the timeline for a lot of those symptoms. The highest risk for the side effects, the things to look out for, the neurologic toxicity, the fevers and shortness of breath and things, are in the first few days of each dose of receiving therapy. Some of those therapies actually, because of the neurotoxicity, they don't let anyone drive, any patients drive for the first few weeks after receiving a bispecific. So knowing the timeline that in those first few days that you really have to, check the temperature, have a plan, know who to call, watch for those symptoms. But as the weeks move on, like after the second dose, there's much less toxicity. Third dose, even less risk. Fourth dose and on is very rare to have any of those toxicities. And so then you can relax, and usually people are able to drive. So being aware of the timeline is important.
Yeah. Are there advances being made in the management of side effects for bispecifics?
Oh yes. And so that's one of the really exciting things is is what I was just talking to one of our trainees about this, about the evolution of the bispecific antibodies have been to make them more effective, make them more sticky, make them engage those T cells more while decreasing the toxicities. And so, the ones that we're seeing that are in clinical trials now that hopefully will be approved soon have less of those side effects, less hospitalization, and actually have a longer frequency of being given. The other thing is that we're really beginning to learn a lot about treating cytokine release syndrome, especially severe cytokine release syndrome. So there was a drug that was used to treat severe COVID called tocilizumab. And that was, used when people came in with COVID symptoms, which can be a lot like cytokine release. They would receive this medication to help control that. Now we're using that to treat cytokine release syndrome. And there's quite a bit of data, especially in multiple myeloma, and using it prophylactically to prevent cytokine release syndrome. And there are studies that show that the usual rate of in multiple myeloma, kind of the specialty that I have, the usual rate of cytokine release, some cytokine release is about 70% with using prophylactic tocilizumab, which is just an antibody against one of those cytokines, IL-6. It goes down to about 25%, so 75 to 25. And really it has no adverse side effects and doesn't do anything with the outcome or the effectiveness of the bispecific antibodies.
Well, that's an incredible difference, isn't it?
Yes, yes. And was really the trick is, trying to get insurance companies to approve it and to get hospital systems to approve it. But I am very confident that very soon, as we get more data about using it prophylactically, that they'll be incorporated into the guidelines.